For those who don't know me, I'm Megan Ranney. I'm an emergency physician, the academic dean of the School of Public Health at Brown, and I'm also the director of the Brown Lifespan Center for Digital Health. I'm so thrilled to welcome you all to our May seminar for the Center for Digital Health. For those who have not joined before, and I see many familiar faces on here, the center is a collaboration between Brown University and Lifespan Health System to facilitate the development and dissemination of effective and equitable digital health tools that make a difference for patients and populations. We have a number of different strategic initiatives within CDH, and two of those are actually covered by this seminar, both the effort to create community, collaborate to innovate, and education, recognizing that only by spreading knowledge around what we're all doing are we going to move things forward. Mm-hmm. So as part of that, I'm just truly thrilled and honored to welcome Dr. Bobby Wegner and her team at Groops to give our talk today. I'm going to give a brief intro. Bobby is a clinical psychologist, lecturer at Harvard, author, advisor, writer, international speaker, and founding CEO of Groops, which she'll be talking about for the next 45 minutes or so. But briefly, it's an online mental wellness platform that brings folks together to talk about real issues with the help of a trained facilitator. I also want to introduce Charlotte, I'm elevating you, Charlotte Bingaman, who's the VP of Operations and who used to be our project coordinator here at Center for Digital Health, moved on from CDH to Groops, a huge loss for us, but a gain for all of you. And I'm really excited to hear what you've been up to for the last year. And lastly, Casey Cook, who is the Director of Marketing, who I'm excited to get to know. Mm-hmm. As always, the presentation is going to last around 40 to 45 minutes, so we'll have plenty of time for Q&A at the end. I encourage all of you to put questions into the chat, as well as to hold on to them. And Dr. Wegner, I will let you take it from here.
Great. Thanks, Megan. We're so thrilled to be here. We know about you both from your public work, which is amazing, but also from Charlotte, who just speaks so highly of you in the center. And so it just feels personal to be here. And I feel like we have an alignment of kind of mission and excited to share. And we really hope this can be collaborative, and I think all of our nature. So feel free to ask questions. We will sort of pause periodically. And then at the end, leave some time to have some deeper discussion. But please ask away and think about, we invite all feedback. So great, Casey, do you want to? So as Megan introduced, my name is Bobby Wegner, and I'm the CEO and founder of Groops. And Charlotte's here, her VP of Operations, and she does kind of everything, really a Renaissance woman, is really the VP of Ops, and Casey's our amazing Director of Marketing. And where this really came from as a team, and for me, I've been in private practice at Boston Behavioral Medicine for about 14 years. During this time, I was also on a clinical teaching team in the School of Education at Harvard in group counseling and cross-cultural counseling. At the same time in my private practice, I was seeing, I'm sure many people on this call probably can identify, but getting lots of calls around seeking therapy, wanting help. A lot of the patients I had would come in for more of a clinical issue and then stay on for 10 to 12 to 14 years because we would build a relationship, right? And we started to meeting some of their needs that were really not clinical in nature, but were more issues around relationships and parenting and work-life balance and the issues that we all face, but they're really subclinical. But it's kind of like, where do you go to get these needs met? And during this time, I was also, doing sort of public speaking and working with organizations. And I was seeing a similar but different thing where the fundamental thing was people really feeling disconnected, both from parts of themselves, parts of their life, whether it's home, and then also at work. And so I was talking and working with companies around how do you help foster connection and belonging? And how do we think about integrating things like vulnerability and leadership? How do we, use what we call in motivational interviewing or in group counseling, kind of ORs, just like it's literally the skill of active listening. So we're like, there has to be a better way to serve this really growing mental health crisis that is really fundamentally, a crisis of sort of disconnection. And we started this. So this first started before COVID, almost as a restaurant. Here, Casey, do you want to fast forward actually one, please? Oh yeah, okay. So our overall goal today is to talk really about our path. So we've had this, we feel good about where we are, and we've also had ups and downs along the way in true startup fashion. So we're here to really talk about our digital health startup journey, including how we think about integrating things like technology development, team training, branding, marketing, really kind of solid clinical practice, but stripping it of all kind of like the clinical kind of diagnostic assessment stuff, but using the core beliefs and then offering them in a non-clinical way. And then how we've pivoted along the way based on feedback we're getting. So I will really share the front end of this story, and Casey and Charlotte will kind of share their experience too and their respective foci. So ultimately what we are is Groops is a group connection platform really designed to help bring people and organizations grow together through expert guided conversation. So for clinicians in this space, we are a non-clinical group focused solution. So we really live somewhere between support group, so not therapy group, support group. There's a distinction there. And that's important because it allows us to cross state lines, and really sort of a scalable online IO psychologist. So we're this like hybrid model, fundamentally focused on bringing people together to have real honest conversations, talking about the things that are difficult to talk about that many of us don't have the skills to talk about. So we're going to talk about our journey, the problems to solve, what our platform looks like, how we think about training people and who to make this both scalable and good intervention and support. How do we train people around this? What goes into the theory and the thought behind it? Casey will give voice to the audience. How do we match what we offer to the general population? And how do we market this? You know, we always say we're sort of selling clouds. We know these things are really important as clinicians and providers, but a lot of people aren't used to doing therapy, know what therapy is, understand what group therapy is, don't understand the impact of things like relationships on mental health and work life. So we're both doing this sort of psychoeducation piece, trying to say, no, you guys will feel better if you just come here, but you just have to trust us to come here. So that's really our biggest obstacle. The marketing piece is incredibly important because, as we know, stigma is very real and it still exists. And this is a barrier to entry from both a community offering and a business perspective. We've raised money to do this. So we have investors or people we're accountable to, and really we're holding multiple balls at the same time. And then lastly, really talk about strategic pivots, what we've done along the way, and then answer some questions. So in terms of problems to solve, what you all probably know here is, there's a huge mental health crisis. There's many different statistics we can look at, but this is one where 95 million people are seeking mental health support in the next 6 months. And there are many different ways to have these needs met. And so we just picked one statistic focusing on psychologists. And there's only 179,000 psychologists supporting 5 million people at most. So that's really just a highlight, which I think we all know. There's really one really big, important problem to solve without enough trained people to solve this problem, leaving a lot of people without support. So in terms of the clinical side, if you're trying to wrap your mind around what we are, we're sort of support groups for every day. And we fall somewhere between therapy and the kind of private stuff you Google at home at night. Is it normal to be yelling at my child, however many times a week? Is it normal to be thinking about divorce? Things like that you don't really, want to talk to your friends about. You're definitely not going to bring to work, but you would benefit from getting support around. So from a business model perspective, if we know 95 million people are available and willing to seek support, if we also know from a study that 31% of the market population are interested in online support groups, that leaves us with 29 million people to serve. That's a lot of people. And if we capture just 10% or offer services to those people, we can really help close to 3 million people. So there's a big dent to make in this space. And I tagged, I talked about this at the beginning, but what we really believe and what we feel excited about is bringing people together in these groups that are led by facilitators. A lot of the people, and Charlotte will go into this later, have a psychology background. A lot of the people leading our groups think of 4th or 5th year doctoral students. So they have good clinical training. They might not have specialty group training, and that's where we can offer them something they're excited to get. And they also, we pay them, our postdocs and interns at my private practice They used to make like between $30 or $35 for a session, and we're paying $50 a session. So it's a reasonable fee for people who are otherwise, not really getting paid in other parts of their life. But in terms of groups, we really lean into the social connection part. There are often faster breakthroughs. So when you're with somebody and someone goes first, you might have a thought or a feeling that you're not willing to say out loud. But when somebody else says it, you kind of learn through their experience. This is really based on Yalom's concept that the most personal is the most universal, and we learn and grow together. And so you can really do group the way you want to do it. You don't have to share. You can listen, but it's bringing people together, because when there's a facilitated discussion and someone's trained to really get to the heart of the issue, then we can learn through each other's experiences. And at the end of the day, many of our experiences are kind of fundamentally very similar. It's more accessible, it's more affordable. We followed a gym model. So, a lot of typical psychotherapy type groups are 90 minutes in nature, and you sign up for 6 to 8 to 10 sessions, and you make a commitment to kind of do this group for a period of time. And we said for the worried well, who are really who we're targeting, that's not necessarily going to be accessible to everybody. So how can we offer this in 60-minute groups? And how do we build cohesion across the community, not just the group? And how do we offer enough variety and flexibility where people can jump around? So when we first started this, we were doing all digital marketing, all like kind of self-focused support group type offerings. And now we've pivoted to still offer this, but we've also grown into the B2B side and focusing on teams, which Casey will talk about later. So what we know, and some of you might have seen this study that was put out by, the APA, is people benefit from deep and meaningful conversations with one another. And most people underestimate the degree to which other people are interested in hearing about their deeper thoughts. And so that's kind of, I think, positive and hopeful and sad at the same time. We want deeper connection with each other, and we're kind of not getting it because we feel sort of weird, right? Like talking to strangers about more personal, deep stuff. But we actually crave it because we're hardwired for connection. We've seen that through COVID. There's tons of research that around isolation and connection and the value of adding this to our life. And people are saying that.
Great. Thanks, Bobby. So I'll talk a little bit about our Groops platform. If you show the next, great. So we built a custom built online web application. So on our platform, members can come, they log in, they see the calendar. And just like Bobby was saying with the gym model, where on Tuesdays you go to Pilates and Fridays you can pick from yoga, we are doing the same, except with emotional wellness. So we have 4 main categories, which are self-improvement, parenting, relationships, and work life. And so members can come, they can pick a group anytime from 9 a.m. till 10 p.m. at night and on weekends as well. They can jump around. There's a lot of flexibility. Next slide, Casey. Great. The idea is that they come for 1 hour. They connect virtually through our platform, which is also linked through Zoom. You have a facilitator who guides the conversation deeper. You have up to 10 members in the group. A variety of topics. And what's really interesting is every time you come, even if you're coming to the same parenting topic, because different people are in the group, it changes the whole conversation. And so you get different learnings from that. Our facilitators are all trained by Dr. Bobby Wegner in a curriculum that she created and devised. And she also runs continuous supervision. So all our group guides continuously receive support. They can process what's happening in the groups, and they continue their education as well. Here is a little marketing video that we had filmed just a few months ago. So it kind of gives a bigger picture of what Groops is. And it's only about a minute or two, so we can watch it together.
Groops has helped me really see that you're not alone, or you're not experiencing something that no one has ever experienced before. I think it's helpful to hear other stories and really put things into perspective.
Groops allows you to actually be yourself, to come in when it's most comfortable for you.
Groops is an online emotional wellness platform where we bring small groups of people together to have guided conversation about things like stress management, anxiety, relationships, work-life balance, and parenting. These are the things we all worry about and wonder about, but don't really have a lot of space to talk about.
There's a lot of self-doubt in parenting, and groups have made me feel not a better parent, maybe more confident parent.
What Groups provides is that outside lived perspective and that lack of judgment that comes with it.
What pushed me to do this is to feel the struggle. Like I'm a psychologist, I know the right thing, I've read all the books, and I'm still shouting at my kid, or I'm still arguing with my husband, or I'm still like, how do I find purpose in work? If I am thinking it and feeling it, I know someone else is thinking it and feeling it too. And if I can kind of go first, it gives other people permission to say like, yeah, me too.
The group's user experience is super seamless. Immediately, I was able to navigate the dashboard and look on the calendar to see what classes were available that worked with my schedule.
Groups kind of flexes with your own life. You can sign up anytime for 60 minutes. You pick from different topics, whether it's parenting or self, relationships, or work life, and there will be up to 10 other people in the group. You can expect that there will be a group guide who will help create, a safe, comfortable space for everyone.
The first time it clicked for me was when one of the members was really vulnerable and opened up. Breaking that barrier allows other people to drop their guard.
Over the course of our time together, you see apprehension that's now gone because others have accepted you. There was no judgment in the group whatsoever.
We know that there's a stigma out there surrounding mental wellness and mental health, and we are there to help everybody understand that, like, talking about your emotions, while it may not come easy at first, it can really help you feel better and improve so many aspects of your life.
Great. So that was our little marketing video that we made. And then just to kind of recap on our platform, our 4 main topics are self-growth, relationships, parenting, and work life. Great. And now just a little bit on our team training. So we are super proud of all of our group guides who are experts in group dynamics and facilitation. And Dr. Bobby Wegner, she trains everyone in a curriculum that she devised, as well as supervised training. Our group guides have backgrounds in group psychology, IO psych, coaching, education, change management, behavioral science. So we have several clinical psychologists as group guides. We also have an MD and a social worker as well. And a number of them teach with us at Harvard too. So the benefits of our approach, like Dr. Wegner was saying, is that groups, we are support groups. We are not therapy. So the biggest distinguishing factor is that we help people cope with the everyday and their life situations, whereas therapy takes a deeper dive and treats people. And we are not that. We think therapy is great, but we are offering support. And that is very helpful to us because it allows us to scale, because we're not bound by state licensure. So we can hire people across the US and train them. And since we are a virtual company as well, that makes it so much easier. Our big goal truly is to make mental wellness more accessible and affordable. And I know that this idea of accessibility is something CDH really values as well. And so I feel super aligned on that. We think that it's really great that when someone is finally ready to talk, that they don't have to wait to see someone. They can just jump online and have a community to speak with. So perhaps they're waiting for their therapy appointment, or they're doing this alongside therapy, or maybe therapy is overkill. And so that's kind of the group that we're approaching. We also come in at a lower cost. We can be accessed virtually and on your own time, so people can jump around, cancel at the last minute. We're trying to reduce stigma. So we are not treating anyone, right? We're just saying we're here as humans. We all have struggles in our relationships. We all struggle with purpose at work, or stress and anxiety, or whatever it might be. And we're just here to talk with one another, because there is a healing power of social connection. And I know a lot of you have seen the research too on the pandemic and all the issues that isolation and loneliness is causing.
All right. Thanks, Charlotte. Hi, everybody. I'm Casey. I'm going to take you through a little bit of audience and marketing goodness. So when we think about the people that Groups is really designed for, we call them self-progress seekers, our little, handle. But essentially, these are folks who have some level of like self-awareness and introspection that pushes them to pursue greater health and wellness in a lot of different aspects of their life, physical, emotional, all kinds. They want to have healthy relationships. They want to have some kind of, purpose, and they're also more naturally drawn to different social activities or group activities. Of course, some folks who come to Groups are, not necessarily like the most extroverted people in the world. And, we know, and Dr. Wagner knows, especially how so much of what people get from group conversation is just in the listening. So you don't necessarily have to come be the most talkative person on the planet to get a lot from group conversations. And when we did a survey to figure out where are people really looking for support, this was just a general population survey. So we didn't even, filter by any kind of want of greater wellness. And overwhelmingly, people are, raising their hand saying, I want stress support. That's also one of our most popular groups is just about managing stress, because I think every one of us would identify with that. How do I, make sure that I'm doing all the things I can do to have a connective, good, healthy family life? How do I make sure that I, as myself, feel like I'm on a path to growth and progression in life, and I'm being the best me for myself and those around me? Lots of folks, of course, always need, help and support with grief or loss and any kind of change management in life, low mood. The list could really go on and on and on. But what was really striking is just how high these numbers were in terms of how much people are interested in some kind of support around these things, because they just don't have it day to day. I'm going to not read you every single word on this slide, of course, but just as like a representation for how we think about our audience, whether we're marketing to them directly through some of the channels that I'll walk you through, or through, the organizations that they're a part of, they're still somewhat going through this same kind of journey. So journey mapping is just a really great exercise to build a lot of empathy for your audience. So again, not going to read you this, but essentially, like, what are your people going through? And then where can your brand or solution be of help is what we're trying to answer here. So what are these folks like thinking and doing at different levels of awareness and familiarity with our solution? How are they feeling? What are the key questions they're asking themselves? And then how can we step in and be of service or be of help? And then where do we connect with those people in terms of channels and messaging to be able to say, hey, you didn't know this, but Groups is a solution that you've been looking for, and here's how we can help you. So give it a try. So how that comes to life, more practically speaking, in terms of how we approach marketing, this is our launch year. So really at the beginning of 2022, we were like, all right, we're going to be really bold. And what we want to do is make Groups the most well-known and loved emotional wellness brand. And how do we start that? How do we start? No one knows who Groups is because we're just launching. So our, starting goal is we have to build brand awareness and familiarity. We have to help people understand what Groups is and how it can benefit them. And then of course we have to build usage. So we need to bring people into our platform and then actually like retain them by constantly getting feedback, which we'll talk more and more about as we talk about different pivots that we're making, so that we're giving people the experience that they want. And because we have this custom platform that we've built, and because we're so close and constantly getting feedback from our community, we're sort of always in this mode of transition, working together as a team to build and do what is going to make people feel best about the Group's experience. And of course, we want to turn our users into advocates, but we've also been building a lot of different strategic partnerships with influential people and organizations to help sort of leverage some of their influence or credibility as we build up knowledge about what Groups is in the world. And just to get really geeky about sort of more like marketing theory, there's a 25-year study that was done by two people who are basically considered like the godfathers of marketing effectiveness. But essentially everything that you do in terms of marketing activities can fall into these two categories, and they work in tandem. You can't really have success in one without the other for your business. So everything that we think about doing from a marketing perspective either falls into the brand building bucket or the sales activation bucket. So when we're thinking about brand building activities, what we're really doing is emotional priming. We're building some kind of association with groups in people's minds. So through the emotionality and the messaging you saw in that video, through content marketing, through social advertising, which we'll show you some examples of. So that people understand, okay, this is the feeling that this brand is giving me, and this is what they're about. And what that's doing is helping us be able to prime for future sales, helping us really to build our brand long term. And then different sales activation activities are really leveraging that brand equity that we're building in people's minds, so that we're able to say, okay, now that you know what Groops is, here's the specific target audience, here's specifically what we're asking of you, whether that's to trial, to attend an event, what have you. We have some kind of call to action so that we're asking people to take action in the short term. And again, just to be sort of geeky, the way these things work together long term is that a lot of what happens is that brands don't do enough unless they have lots and lots of money, of course, like the Coca-Colas of the world, to build just sort of like an association with their brand. So brand building over time is just going to make everything you do from a sales activation perspective more effective. And so often, I spent the last 15 years working with different clients like Target, Medtronic, Optum, US Bank, just big brands in the world. And they were just so focused on short-term lifts that they couldn't think about what they needed to be doing long term. And both of those things have to work together. If I asked you guys what you associate with Coca-Cola, you'd probably be like, oh, well, I know, of course, they make drinks, they make soft drinks, and now a bunch of other things, but you would also associate emotionally them with probably happiness and like feelings of goodness and togetherness, because that's what they've built over time. So when you're actually at the shelf and you're choosing between Coca-Cola and Pepsi and some kind of tea, you're even unconsciously have those associations with you to help you make that decision. Just again, as just a representative example, what we do when we're thinking about planning for channels is think about the different channels that are best suited for brand building and the channels that are best suited for sales activation, or a combination of the two. And again, I won't get into the details here, but just wanted to give you guys a sense of all the different things within our launch year that we're trying to basically test and learn what is most effective in terms of reaching people and reaching the KPIs that we have established. So the main things that we have done just in the last quarter, really, the main drivers of conversion for us have been social advertising, and I'll show you some examples of that, paid search and email marketing. These are sort of like the baseline sort of digital marketing things that we need to cover as a new, especially like digital first brand. Our platform only exists within the digital universe. So that's where we have been capturing folks. And we'll talk a little bit about how that's evolving. But I wanted you guys to see, you can see my browser opening, right? If anyone wants to tell me with their voice that they can see me.
Yes, you can see that, Casey.
Perfect. So for any brand that exists, if this is helpful, just either from a curiosity standpoint or when you guys are just thinking about how different folks are marketing their different digital health solutions, if you go to their Facebook page, because obviously Facebook or Meta owns both Facebook and Instagram, there's a transparency tab where you can go to their ads library. So for any brand under the sun, you can see all the different ads they're running at any given time. So I just wanted to show you some of ours. So we have been trying different creative types and different formats. For social, video always outperforms static content. So we, that video that you saw, have cut into a lot of different different edits so that we can use those as social videos. We also have videos just highlighting different groups. So people might, come in and become aware of groups based on, our larger videos so that they can really understand what it's about. Or they might come in more topically around a specific group interest, like unpacking pandemic work life, mama moods, building strong bonds with your kids. So just wanted to give you guys a glimpse at this, because not a lot of folks who aren't in marketing know that they can just go explore anything that people have in terms of social advertising in the world. All right. And then, oh, go ahead.
All right. I was just going to talk a little bit about the strategic pivots. We're going to go deeper into this, but basically, as any startup, we are learning and testing and changing as quickly as humanly possible. And so you're actually catching us right now in a big strategic pivot that we are doing, really as of like a week or two. So all this is very fresh, but we wanted to share with you what our findings have been from what we've tested on what we just talked about. And so the first question we were trying to solve for was, does this work? Like, can people have a connecting experience that feels transformative in a 1 hour time with strangers with a facilitator, right? Or do you need to be in a cohort of people that you know and you come for 6 weeks straight, like kind of what people are more used to perhaps? And so what we found is it does work. Like, people are self-reporting, our members are self-reporting that in a 1 hour time span, they feel a transformation within. We're also, as group guides, at the beginning of every group, asking people for their kind of like starting emotion. So when they're showing up to the group, how do they feel? And then at the end of the group, we ask people how they feel, and then we write it down. And what we're finding is people, the majority are coming in feeling very stressed, anxious, down, in a low mood, tired. And when they're leaving, they're saying that they feel like connected, they feel lighter, they feel energized. So these are all things that we hear a lot. We're also finding that we have about 70 new members signing up per week on average. And for May, for Mental Health Awareness Month, we offered our entire platform free, and we had up till now up to 1,000 new members joining. So we do see that the marketing is working, people are interested, they're coming, they're having a good experience. That said, there are, of course, always issues that we're trying to manage. So we do have some issues with no-show rates. And then technology is just always going to have some kind of problem to solve. So whether it's like time zone issues, the calendar shows up in one time zone, then you travel and it doesn't change, or email syncing, or IP addresses being blocked. And what we're finding as a startup is that it's very expensive to test and learn with third-party developers. So we built this custom-built platform, but that also means that we have to go to this developer every time we want to change something. So then as a startup, we're trying to decide, is it worth putting our resource towards hiring our own full-time developer, or do you put that more to marketing? Or like, how do you allocate the resources we have until we do our next fundraise? We also did some UX interviews with our members. And one thing across the board that we found was that people want to have more meaningful social connections. So they were saying they wish that our platform had ways to chat or have discussion boards, have other ways to kind of build this community online together on the Groops platform, which is something, that we then discussed building out. And so then it's a question of like, do we focus on B2C, which is consumers, and building this all out when expectations today are very, very high in the digital space? Like, if you think about the seamless experience you have on Facebook or on Twitter, if they come to a site where something is a little bit wonky or not completely right or not doing what they expect, like they easily get spooked or go somewhere else, right? So then it's a question of like, as a startup, do we pour our money into tech and build this out because we are a tech-based company, or what pivot do we want to make there? And then Bobby, you're still muted, I think.
I was going to say thank you, Charlotte and Casey, for it's really fun for, I think, all of us to do this with you, because we're always so in the weeds. So we're saying this is almost like a little narrative therapy for us to take a step back and be like, where do we start? Where are we and where are we going? And it's really fun to actually do this too, like just listening to you all speak. What is been, I think, engaging and stressful and fun and exciting. And we sort of have a joke that being in startup world is like a roller coaster, and we're all stepping in from different spaces, right? Casey's been in marketing. Charlotte was literally with you all at Brown and at Harvard before. And and I've been a clinician. I'm a psychologist fundamentally. And now we're trying to build this tech startup. And so we're all learning these new ways of doing. I'm going out to investors, pitching VC funds, talking to people, trying to tell our story, learn the language in which people like how you deliver this, what do you say, what, you know, and it's been a very fun and exciting growth opportunity for all of us. But in terms of investment side, which is, you know, I've sort of taken on as my role as CEO, is, you know, what we have learned is that there's a big problem to solve in the mental health world, and emotional wellness and connection. Those are huge, huge amorphous categories. And there's different ways to tackle this. We have limited funds. We have to be very strategic in our approach. And time is not on our side for a whole bunch of different reasons. You know, we want to help people. We want to get this out there. We also, you know, are spending money with every learning. So digital marketing is super, super expensive. So we thought that we put this thing out there, there's such a need, people would come in, and people have been signing up, but we've been having a no-show problem because we're going after the worried well. So if we think about like willingness to change or sort of Prochaska's, you know, readiness for change, we're going after people who are kind of in the contemplative action state. So their pain point isn't super strong. The people who have really strong pain points need therapy, and that we're not ethically like available to provide services for. Well, we also, so the digital marketing piece is really expensive. One thing that we were doing was really leaning into digital marketing at first, saying, can we put this out there? How much is it going to cost to acquire customers or get people on our platform? You know, I think Casey did a really great job creating ads and doing marketing that allowed us to get, you know, this is language I've learned, CPL, get our cost per lead down. But we just weren't seeing the traction that we wanted to see. And in the backdrop, we were testing B2B, building B2B relationships. We launched with an ad agency in November, a 250 person company, to say, how can we bring this as a wellness benefit to you? And what does this even look like? How do you integrate emotional wellness in work? Well, what's the line of like enough, but not too much? Do people want to do groups live? Do they want to do it in person? Do they want to do workshops? And so we started to kind of build out these relationships, and people started coming to us. So we're like struggling, wrestling with this B2C side, spending all this money, and these kind of bigger name people are approaching us. So we've launched with Sacred Heart University as a faculty wellness benefit. We launched with Cole McVoy. We're in talks with GE Dubai with their power, working with their leadership team. We're in talks with Motiva. Boston Children's Hospital has agreed to pilot this with us. So we're working out the details there. We're in talks with Harvard about launching this. So so we're like, wait a minute, this is not right. Like, step back and look at what the market's telling us and how do we recalibrate. So as hard as that is, we're doing that right now, and we're leaning into the B2B side. Also, from an investor perspective, they are investors see B2B as consistent, reliable revenue, and we're a more reliable product, especially at an earlier stage, that they don't want to dump a bunch of money to see if digital marketing is going to work. So from an investment perspective too, we become more attractive to kind of better investors who give us better or good strategic advice to build this out. Casey, are you taking or am I taking this part?
I think you should just continue.
Okay. And then, so just if Charlotte and Casey, something strikes you, then, you know, jump in. So where we're really moving is we started off as really an emotional wellness, individually focused platform, right? Just like the gym, you go to the gym to work out, you come to groups to talk about your private stuff. And we took group psychology principles to create these support groups for every day. So the values are still the same. We're still using group principles. We're still sort of, you know, practicing group dynamics and facilitation, but instead of just emotional wellness, we're like, no, we can help people use these skills to connect better at work, feel better at work, and still have the groups we've already established as a private wellness benefit. But now we're really going into organizations saying, we can work with your team. We'll come in once a month, and we will talk about things like vulnerability and leadership, improving communication, improving listening, roles and dynamics, right? Like, when do you ever show up at work and talk about power differentials in the room? And then how this is getting in the way of safety and belonging, right? That's like not what most people feel comfortable comfortable with, they feel it, but they don't actually understand the dynamics. And we're saying we can help you give a little psychoeducation at the front end for 10 or 15 minutes. And then let's do a group together to actually think about how this plays out. So I think in the workspace, a lot of people come in and we do lectures, right? There's probably a number of people here that get invited to go to companies to give a talk, but the companies don't have the opportunity to have ongoing practice in these skills. So we're like, we can give a little bit of this. We will, teach you how to do this, but let's talk about it in the room now. And we'll be back in a month and revisit this. So it's like, we would never say this to our people, but it's sort of like, ongoing groups for teams that are kind of, it's not psychotherapy. It's like team building, relationship-based group connection. And so what we know on the B2B side is that having, we're seeing this with the Great Resignation, disconnected employees are disengaged. They feel not good. There's poor productivity. There's low collaboration, missed work days, low innovation, poor well-being, both in terms of physical and mental health, and high turnover. For companies, this is a nightmare, right? Having people leave costs a lot of money. If you can have a good workplace and a strong culture, it becomes a differentiator. People say, I want to work there. Culture is the same as family dynamics, right? It's like you want to be a place people want to be. It costs you less money over time. And when you feel like you're safe and you belong, as we know, your amygdala is like not firing as much. Your frontal lobes are freer to be more innovative, more creative, more exploratory. This is all good for companies. When we don't feel like there's good culture, when we don't feel like there's safety and belonging, like you're stressed and you're not able to work as effectively, you have poor communication. And so we're like, let us help with this. The tools that are out there now, so organizations are trying, right? I think we applaud organizations. They feel the pressure from people, especially after COVID, thinking we have to do something different, but they're kind of plopping in personal coaching or collaboration tools like Trello or Slack or Team. There's workshops, like I was just mentioning, they're like outside activities, which is great. They're adding benefits, but the fundamental thing is there's a connection deficit. So you can put all these things in, but it's like putting cold ingredients into a pan and expecting to have this wonderful dish that all melds together. You got to like turn on the heat and build the connection, more like the connective tissue between these things to actually to create something that's more meaningful and special. So having the tools is important, but knowing how to use them, knowing how to put words to the dynamics that are felt is really important. And we're still on the kind of back end of it. We're still rooted in the same kind of group psychology theory, but we also not just teach it, we teach people how to like practice building cohesion and building a strong culture. And so the people that we're sort of targeting now, by partners, we mean companies. They're people first organizations and highly collaborative industries who want strategic solutions focused on employee wellness. They're community minded, places like universities or healthcare, highly collaborative, thinking about ad agencies, and we're particularly primed for companies or organizations experiencing transition. So think about when, a family, there's a divorce, there's a blending of new families. There's new values, new shared purpose, new dynamics. Mergers and acquisitions in the PE world is very similar. So going in to say, listen, there's new dynamics at play. Let us help you understand and come up with like a new way of thinking about this new team. And what this actually looks like is we go to a company now, and what we've been doing, we do a needs assessment, we come up with goals, articulate the values. Those self groups are the ones like on the video you watched, those are still available. If you were to do this, in your department or at Brown, it's like you could still log on to the groups. There's a no colleague guarantee. You could do a stress management group. You will not see anyone from your department or your organization there. The teams part is where, okay, we're going to come to your department once a month. And based on this needs assessment, we have a 12-month program to say, these are the topics we're going to cover. You're going to learn a little about it, and then we're going to figure out how to apply it to your team. The organizational groups are really like workshops. So for example, we were in Minneapolis last week. We did a talk on how do you integrate vulnerability in the professional space. We all know this is important, but there's some line between oversharing, not sharing enough. How do you build in a vulnerability loop, not just random self-disclosures, right? These little nuanced things, people know they're important, don't know how to do. So we gave a talk, we broke everybody out into small groups. They talked about their own teams. Then we came back together and did sort of a summary. And HR people are particularly siloed. They're tasked with scheduling out these like workshops. And if you go and give a talk, you know, they're used to paying between $1,000 and $8,000 per talk that they have to schedule. There's really not a strong quality control there. They're just hoping the person who comes in is going to be a great speaker, and they're paying a lot of money. And we're saying, listen, we can own that for you. We have a whole team of wonderful group guides who can actually speak on different topics. And on top of it, God forbid you have a crisis in your, in your department or something, and you just want someone to consult with from more of an IO perspective, we can help with that, and we're available. And that's where really the relationship matters. I want to wrap up soon because we're getting running out of time, but this is sort of what it would look like. So the self groups, you could go to like a stress less group, a great reflection group, how to lead a purposeful career group. Team groups focus on things like difficult situations. What do you say when there's a difficult team member? How do you address it in an empathic, collaborative way? How do you think about dynamics and roles and power differentials? What's the recipe for better collaboration? Workshops include things like vulnerability, belonging, and leadership. And these are some of our competitors now in the B2B space. And so you can see these are very kind of like also siloed. There's collaboration tools, coaching, skills building, performance management, individual wellness. And we're saying, listen, let us help with both the wellness side of things, the lecture workshop piece, and also the team building. And so, you know, we are able to cover most of these things with one offering rather than breaking this up into very kind of niche type offerings. So groups, you know, brings group psychology. We strip it of the psychobabble, right? Everything we do is, I mean, I could talk more about that later, kind of where this comes from, but it's really fundamentally stripped down group counseling type skills that are sort of infused with more of a CBT, clinical health psychology background. We believe in, you know, the quality of our life, as Esther Perel will say, is determined by the quality of our relationships. We lean away from the tech and lean into the human relationship part. And we use a platform that's scalable. So that's what allows us to offer this. So at the end of the day, our goal that drives us each and every single day, that gets us out of our bed, is we really believe that building a more connected world is the kind of the solution for a lot of the things we're seeing and feeling now. And bringing people to talk is, you know, really simple. It's just a simple solution that is at our fingertips that can actually have a huge impact. So we just appreciate you listening. And now we have about 10 minutes or so to answer any questions. So we see some questions in. So maybe I'll read the first one from Molly. So Molly says she's curious about whether there's a way which you support client gains, and if there are any forms or other methods of allowing clients to socialize outside of groups themselves. So does Charlotte or Casey want to take that?
I think, yeah, I can address that. I love that question. I'm just like sitting here thinking about it. I'm assuming by client gains, you mean like the objectives and things that they're after. So when we go into working with an organization, or all the folks that we're in talks with right now, they're all experiencing the same like macro problems that come from disconnection, but we're really getting into like having intimate conversations with them about what they're experiencing at every level of the organization. So what is leadership experiencing? What are they seeing in the culture overall? What are different teams experiencing? And what are individuals experiencing? And then we're designing curriculum across those different group categories that you saw, in order to address those. And then doing surveys essentially throughout our relationship with those folks to be able to track progress against KPIs and goals that we've established over time. And we have optimization sessions ongoing with our clients. And then the notion of, you know, forums or other methods of allowing them to socialize outside of the groups. I think like what's so special that we've realized about groups is exactly what Dr. Wegner was just saying, that we're putting this into practice practice for people. So often, you get a speaker, you get some like training, or you have a consultant come into your organization, and then it's like, all right, best of luck, bye, and then they leave. And what we're doing is we're helping people do this on an ongoing basis, so that then they're applying it every day, and they can, have not just like the theory, but the skills that they're building over time.
Yeah, thanks, Casey. And then John, thanks for your question too. So it's really relating to about sort of making this equitable and available to people. And, we sort of mentioned our target population is someone who's college educated with a household income of $75,000 or more, which is, a pretty limited population. And how are we really thinking about this? So that's a very important question. I'm really glad you gave voice to that. And I can tell you about how we're thinking about this from like a values purpose perspective, and then how this is translating to like what we're actually doing. So from a brand building, who are we as a company? We talk a lot about this, like how are we going to make this more available to people and run a business at the same time, right? Like there's money coming in, that there's a pressure to get revenue in, and also we want to be equitable and available. So the way we thought about that is, it's priced on the B2C side with now it's $60 a month. So if you use your co-payment to go to get mental health support for one therapy session, the likelihood, if you have private insurance, of paying $25 per co-payment is really high. So we're like, okay, we're going to be more affordable than that and have more ongoing support than that. We haven't done this yet, but we were like, how can we make empty seats? How do we build partnerships with communities? We're saying, listen, we have empty seats in the group at 7:00 tonight. Who from your community do you want to invite to take these empty seats for free? So we haven't done that yet, but this is sort of kind of in the backdrop of our mind. And in terms of Mental Health Awareness Month, we're like, so if we go back to really what we're doing here, the most personal is the most universal. That's the fundamental belief here. So if we can be income and SES status, if that's our belief, then SES status should become less relevant. So with that in mind, we open groups up to everybody. And so it was kind of stressful, I have to say, on the clinical side of this, or going to log into the group, just having no clue who's going to be in a group. And we're really coming back to the idea that most personal is the most universal. And there's a fundamental sharing. If we can get people to share, there's more similarity than difference here. And so that's really what we did, and what we're in now. It's like we're having people from all walks of life coming to groups right this second, because it's free, and it's super cool, and it's super powerful. And we're learning as we go. We'll see how this plays out, and then we have to activate some of our mission too. Casey, do you want to talk about that from a marketing end of things, or?
Yeah, I think that what's limiting as a startup is like we need to make money and in order to give back. And that's just sort of like the reality of the world. But to Bobby's point, like that's something that's important to us ongoing. And as we, have developed these partnerships with companies, we're making a list of organizations that aren't, companies who are going to pay us, but companies that we can just give groups programming to. So as we have like our servicing paying clients, we're able to go into different types of organizations or communities and say like, hey, how can we help you? And that might look like our traditional groups offering, or that might look like, other ways that our core team and our group guides can, go and facilitate conversation. Because at the end of the day, what we're delivering is connection, and that's something that should be given to everyone, a skill to build, and experiences that bring people together.
Thank you. I'm gonna jump in and ask a couple of questions. I'm gonna combine together two questions from the chat that I'm hoping that we'll get to in our last couple of minutes. One comes from Adam Lukowitz about data, and about have you thought about actually kind of demonstrating, right? Like I think and Charlotte and I had a number of conversations about this when she was with us, but as a company, you need to get up and get going and create the product, but then there's also the proving the efficacy. So have you thought about doing a clinical trial? And then the flip side of that in terms of efficacy is, how do you handle the inevitable ethical issues for folks that are participating but have more acute support needs? This is something that we've touched on before in other seminars, and is a huge discussion point, obviously, within the world of digital mental health.
Yeah, those are two really big questions. Charlotte, I feel like this is, do you want to talk about the data piece a bit, or I can, I'm okay with either. But also if anyone who actually wants to partner to do a clinical trial of this, like, give us a call. We would love to do more here. But Charlotte, do you want to talk about the data and sort of I can talk about that piece, or you can.
Yeah, definitely. I can just say we are definitely putting a lot of thought into this. This last year has been really focused on building the product, the brand, the platform, marketing, getting everything out there. So now we're thinking more about, okay, how do we prove this with data? How do we collect it? What do investors want to see as well, right? Because as a startup reality is like, we have to make money too, and we have to answer to investors as well, right? So now that we're kind of pivoting towards B2B, we have to think about like, do we show this in numbers of like retention rates at companies or improvement in engagement or productivity, and then how do we show it on like the B2C side as well? So I don't have all the answers yet for you, but it's something that's definitely on our mind right now. And we're actually like combing through a bunch of research and trying to see like quality of life measures and like, what do we use here? So as you can imagine, there's so much to think about. And just every day is a change. So that I can say on there. I don't know, Bob, if you want to address the ethical questions that we've also went over like all the time.
Yeah. So the good news is, so you see the three of us are really the ones working day to day around the clock on this. We have the benefit of having an early investor who has kind of back office support. So we have a lawyer on staff, we have HR people, we have accounting, which has been a bonus to kind of run through some of these questions with. In terms of data, the simple answer is that the easiest way for us to collect this is pre and post emotion, beginning and end of group in real time, so we can get 100% participation, and we're tracking it. That's not enough. We ultimately, using B2B and B2C, we're tracking two different data sets. So it's mental health outcomes, emotional well-being, things like quality of life. We would love to tie this to physical well-being too, because it also opens us up to then be connected with, like more available or accessible as like almost like a health solution. The B2B side are things like attention, retention, engagement, and productivity. From the ethical perspective, the way we've thought about this and from a framing or a theoretical perspective is like, should we have a screening at the front end? Who's going to come in? Do we put people in groups, or do we allow this to be self-selecting? And we made the decision to let people self-select into the group based on, they have the opportunity to meet with us for 20 minutes if they want to get some guidance around this. But ultimately it's a self-selecting group, just like an AA or something. You can pop in, you don't know who's going to be there. But we put a lot of effort into building this into our platform. So we have on-call psychologists available. We have an emergency button and a protocol that if something goes sideways, if somebody's actively going to hurt themselves or someone else, then they get put in a breakout room and a psychologist comes and does, an assessment there. Mm-hmm. And we built that out from both the training part, but also the tech part. What do we do when someone gets in this breakout room? Who are you going to call? We've thought about this piece of it. And if someone's in less imminent danger, then it's just a meeting with a psychologist on one of our staff.
Awesome. Thank you. Well, Bobby, Casey, and Charlotte, thank you so much for joining us, and to all of our attendees. Thank you for joining. Thankful for the awesome questions. I love this chance to have a real discussion with a real company who's taking the science and extending it into something that actually scales for impact. Allison just posted into the chat for news and updates on upcoming seminars. Join our listserv. And also, please, please, please complete the survey that she put a link to as well. So there's a survey, and then we'll also have a link for joining our listserv for future seminars. Thank you. And have a wonderful day. Take care of yourselves.
Thanks,
Bye,
everyone.
everybody.
Yeah.